The first question is for Dr. Faisal. Dr. Faisal.
دكتور تفضلي.
تفضل يا فندم. The first question said that I would like to ask you one question. If the patient elderly with dementia or bedridden and the TSH between 7 to 10, how can I assess the patient symptom hypothyroidism?
Yeah, actually, for the elderly people, normally the pituitary will be affected physiologically by aging. We call it aging of the pituitary. So the TSH in elderly people up to 7, it's normal. Up to 7, it's normal in elderly people. From 7 to 10, you should treat upon the clinical picture of the patient. I don't think dementia is one of the depression. If there is major depression, if there is senile depression, yeah, I can consider it as indication for treatment.
شكرا لحضرتك يا فندم. I think this question is for Dr. Hani. Dr. Hani, how many percentage of patients diagnosed as a thyroid cancer without family history of cancer? I want to ask specifically about rate. Can you give us more details about the cause? Or that because we exposed every day to the radiation in ER with the critical cases. ربنا يسلم الجميع يا رب.
ايوه ربنا يسلم الجميع. طبعا this is very important question. طبعا yes, it is a risk factor. Radiation is a risk factor. Most of our colleagues in radiology and radiation oncology, they always wear shields, radiation shields. Unfortunately some of them يتهاونوا في موضوع الشيلز بالذات thyroid. تلاقيهم most of them they put the shields of the chest and the lower abdomen and legs, and they forget to put the neck shield. They all have to put the neck shield because it is dangerous. It is a risk factor for thyroid cancer. And I got quite not a lot, honestly. I don't want to scare people. Honestly, it's rare, still rare, but I got maybe 1 or 2 of our colleagues from orthopedic that they use a lot of radiation in their surgeries and radiology. And all of them, they don't put the thyroid shield. And I've never got a patient who put the thyroid shield and protect the thyroid with thyroid cancer. So if you put the thyroid shield, inshallah, you are protected. 80% they don't have any risk factors.
This question, I think it's for Dr. Hani. Dr. Hani, the question is, what about the fine needle aspiration?
Thank you very much. أنا نسيت أقولها. أنا كنت حاطط في بالي أتكلم عن الفاين needle aspiration.
شكرا دكتور هزار.
Question every single day. Fine needle aspiration, number 1, it is very, very safe. Almost no complication from fine needle aspiration. The common method, الاعتقاد الخاطئ, very common that I get every single clinic, إنه doing a fine needle aspiration will spread the cancer. This is completely wrong. And please, alhamdulillah, اليوم في 2200 حاضر, does not spread cancer, and it is very important step in the management of thyroid tumors or thyroid nodules.
Dr. Faisal, what is the risk of pregnancy with the hypothyroidism? How to prevent miscarriage? How to maintain safe pregnancy with the hypothyroidism? And what are the preventive measures after first miscarriage to receive to conceive again?
ايوه احنا في السبكلينيكال هايبوثايروديزم بنعالج في البريجنسي اذا كانت تي اس اتش بين 2.5 و 4.5 وكان في عندنا بوزيتيف انتي ثايرويد بروكسيديز انتي بوديز، وبالتالي من باب اولى اذا كانت تي اس اتش اكثر من 4.5 يعني we should treat the TSH in the normal range and the second half of the normal range, but with positive antibody I should treat. طبعا التريتمنت في الفيرست 3 months اللي هي الكريتيكال بيريود انه ممكن يصير فيها مسكرج، احنا بنشوف البيشنت almost monthly وبنكون حريصين انه التي اس اتش يكون from 0.5 to 2.5 maximum. بعد كده خلاص ممكن نشوف البيشنت every 2 months until the end of the pregnancy.
دكتور هاني،
اتفضل.
what is the role of the thyroid scan in management of thyroid cancer?
A thyroid scan, they usually do, correct me Faisal if I'm, thyroid scan for patients post treatment to see if there's any residual tumor anywhere, microscopic tumors in the neck. And if there is, they can give them radioactive iodine afterward. But I don't think we do usually thyroid scan regularly for, as a follow-up.
ممكن قصدهم الهول بادي سكان اللي هو البري راديو اكتيف ايوداين وبوست راديو اكتيف ايوداين.
ايوه هو they do it بالضبط. They do it قبل التريتمنت. Before treatment they do the thyroid scan to higher dose for treatment or not.
بس طبعا هو نت روتين انه نعمله كفولو اب. احنا الفولو اب بالالترا ساوند بالتي جي وبالتي جي انتي بوديز.
I think this question is for Dr. Hani. After removing thyroid cancer, when we need to follow up?
I've mentioned, I can put the slide مدام معروضة. Here we go. الفولو اب هنا موجودة. الفولو اب تقريبا every هنا اهو. This is the slide. This test should be performed annually for the first 2 years and then every 5 years for 20 years. هذا الفولو اب. Simply الفولو اب يكون بالثيروجلوبولين testing and sometimes ultrasound. In some occasions we do diagnostic thyroid scan.
دكتور إبراهيم عيسى، أهلا بحضرتك يا دكتور. طيب دكتور إبراهيم عيسى بيسأل as you know, even when recurrent laryngeal nerve is preserved, sometimes patients have vocal dyskinesia due to nerve pressure or heat, which cause temporary voice change. How often do you experience this after thyroidectomy, and how long usually his normal voice?
Simply when we have pre-op, almost always if there is a paralysis then it is cancer, almost always, right? Post-op sometimes we get weakness in the nerve, and that's why I use the nerve monitor to decide upon moving to the second thyroid or not. First of all, it's not common. Temporary vocal cord paralysis or paresis is almost maybe, I would say 10%, not more. But permanent paralysis is way less than 1%. From compression, we don't get it. Honestly, I've never seen it. I know it was mentioned in the books, but I've never seen a single patient with paralysis secondary to a benign nodule. So it's almost always cancer whenever they have pre-op paralysis.
The last question will be for Dr. Faisal. Dr. Faisal, what is the prognosis of the Graves' disease? And is it considered type of thyroid cancer?
Benign thyroid disease. فكرته انه الاميون سيستم بيرسل stimulating antibodies للتي، فبيصير في نوع من الاوتونوموس increase production of thyroxine، فيصير عندنا state of hyperthyroidism او thyrotoxicosis. طبعا it's a benign condition, it's not a malignancy، لكن احيانا بنلقى papillary thyroid carcinoma on top of Graves' disease. عشان كده لازم نسوي مع الالترا ساوند ثيرويد ابتيك سكان عشان نشوف لو في كولد نوديول ولا هوت نوديولز. الكولد نوديولز كان بي مالجنسي، الهوت نوديول التريتمنت حق الجريفز ديزيز ايذر راديو اكتيف ايودين ثيرابي او سيرجري او انتي ثيرويدال ميديكيشن.